fourth session of our webinars this year leading up to open enrollment. This will be a recorded session, and I ask that folks wait until the end to ask questions just for time purposes. And then, again, you will have more opportunities to ask questions during the benefit fairs, at which point you can actually approach one of us and ask, you know, if it's specific questions, whatever it may be, there will be follow-up opportunities. Today, we will be discussing the medical benefits. Tufts Health Plan will be covering the 3 plans that will be rolling out this year, and then Health Equity will be covering some of the account funding pieces, and we will be covering the flexible spending accounts. So with that, I will turn it over to Tufts Health Plan.
Thank you. Hi, everybody. As mentioned, my name is Jennifer Curcio. I'm from Tufts Health Plan, and I'm going to go over your options for health insurance. There are a couple of changes to your current options and also an addition of the third option. So if we want to go to the next slide. So the 3 medical plan choices for 2018 are the HMO Advantage 1000 plan. So this is your current HMO Advantage plan. There are a couple of changes to it that I'm going to touch upon. A reminder, this covers only in-network procedures, so that means you do need to see a contracting provider in order to have your services covered. You do need referrals on this plan to see specialists. I will note that this and all of our other plans do have worldwide coverage for any urgent or emergency care while you're traveling. But again, important to note, the HMO plan does cover in-network procedures only. The changes to this plan, the PCP, primary care provider, and specialist office visit copays are increasing. Currently, your primary care provider office visit copay is $20. That's going to changing to $25. And the specialist office visit copay is also increasing by $5 from $35 to $40. And the final change to this plan, the deductible levels are increasing to $1,000 for an individual and $2,000 for a family deductible. Also offered this year, you still have access to the CareLink PPO Advantage. That is also going to be a $1,000 deductible plan. This plan does provide the option of utilizing both in and out of network providers. So if you decided that you wanted to see a provider that is not a contracting provider, you do have that option. And the next slide will kind of give you an overview of how that would be covered. So the PCP and specialist office visit copayments are currently $20 for each of them, and that is going to increase to $30. And again, the PPO deductible levels are also increasing $1,000 for the individual and $2,000 for the family deductible. And finally, the third plan that we're offering is a new plan for 2018. It is a high deductible PPO CareLink $1,500 saver plan. So this provides the option of utilizing both in or out of network providers. The deductible is $1,500 for an individual and $3,000 for a family for in and out of network. And this is compatible with a health savings account, which is an employee contributed health savings account. So it would be employee contributions into an HSA. We will get into that in much more detail further along in the presentation. But if we want to go to the next slide. These are the medical plan offerings. I actually really like this slide because it gives you a nice side-by-side comparison of these 3 plans. So highlighted in red are the changes that I just went over on the previous slide. So you can see the deductible increases on the Advantage HMO and the CareLink PPO. I want to make a note on the CareLink PPO $1,500 saver. Medical and pharmacy both go through the deductible. Because this is a qualified HSA plan, one of the requirements of that plan is prescription drugs do filter through the deductible. So if you choose to join this plan and you go and fill a prescription, you are going to be responsible for a deductible first, and then prescription copays kick in once that deductible is met, okay? So that is different than the two deductible plans that you currently have. On those plans, the prescription drugs do not funnel through the deductible. They are copays only. Okay. Again, the PCP and specialist office visit copay changes. Noting again on the CareLink PPO 1500 saver, everything on this plan filters through the deductible, and then it would be covered at 100% in network once the deductible is covered. Okay. So emergency room, there's not a copay for that. It goes through the deductible. Outpatient surgery goes through the deductible. The office visits for non-preventative goes through the deductible, and again, the prescriptions go through the deductible. So that is the big change in the way that these plans work, the saver versus the two advantage plans. Okay, so on the next slide, I want to talk a little bit about deductible carryover. Okay, so couple of caveats before I dive into this. Deductible carryover is only applicable if you are enrolled in the same product line. Okay, so that means if you are currently on an HMO Advantage plan and you choose at your open enrollment to continue on that HMO Advantage plan, you could potentially have deductible carryover. Same thing with the CareLink PPO plan. If you are on that plan and you are choosing to stay on that plan, you could potentially have deductible carryover. Deductible carryover never applies to the saver plan because the IRS does not allow it. So that's never an option on the saver plan. Additionally, if you are going from the HMO Advantage to the PPO CareLink Advantage, deductible will not carry over. All that being said, what exactly is this deductible carryover that I'm speaking of? So, on your medical plan, the deductible is the dollar amount you pay for certain medical services, usually those to diagnose, treat, or monitor health conditions before coverage starts for those services. So what the carryover is any amount that you pay toward your deductible in the fourth quarter of your plan year is credited for the current year that you're in, as well as carrying over and being credited in your next year. So here is an example. Joe's plan is from May 1 through April 30th. So the fourth quarter for his plan is February, March, and April. He receives no medical services in the year until he injures his back in February. He sees his primary care provider in February and a specialist on February 26th. There are then follow-up visits with the specialist as well as physical therapy visits throughout March and April. So he has a $1,000 deductible. The visits that he have incurred result in his paying $500 of that deductible. So because those $500 of deductible dollars were incurred in the fourth quarter of his plan, there is going to be a credit for the upcoming plan. That $500 is going to carry forward or carry over and be credited in the new plan year. So the result of that is because Joe paid $500 of his deductible between February 1st and April 30th, his deductible for the following year is only going to be $500 because he has that carryover. Okay? Again, does not apply to the CareLink 1500 Saver plan, and you cannot carry this from one plan to another. It's only if you're staying on the same plan at this next open enrollment. So next slide. Okay, I want to talk a little bit about the Saver plan. The Tufts Health Plan, CareLink 1500 Saver Plan is the new option that you are able to select at this open enrollment. It is a high deductible plan and that it is compatible with a health savings account. again, as I mentioned, but it's worth repeating because this is very different than what you currently have. All services, with the exception of preventative care, are subject to the deductible. This includes prescriptions. I will note that this is the same Tufts Health Plan CareLink network that you are accustomed to using, so that is not a change for you. The provider network is the same. I did mention that all services except the preventive care are subject to deductible. Getting into a little more detail about that, select routine office visits are covered in full of the Saver plan. This includes routine preventative physicals for both adults and children, as well as annual preventative GYN exams, routine prenatal and postpartum care, immunizations, and select disease screenings and testing. Okay? One more important note, and this is a different concept than what you currently have on the two Advantage plans that you have currently, is if you enroll in family coverage in the CareLink PPO 1500 Saver, there's a non-embedded deductible. So what that means is the full $3,000 family deductible must be paid before any coinsurance or copays apply. It's different from the HMO 1000 and PPO 1000, which has an embedded deductible and caps each family member at 1,000. So an example of this is if someone was on a family plan on the current HMO Advantage plan and had to be hospitalized, they would be responsible for only the individual amount of the deductible, which is 1,000. Then they would be covered in full, and the remaining family members would have to make up the rest of that deductible throughout their services throughout the year. If you are on the 1500 Saver plan and you are hospitalized and you're on a family plan, you would be responsible for the full $3,000 family deductible. It does not cap at the individual amount. So you would pay the first $3,000 of your hospital bill, and then any coinsurance, copays, or 100% coverage would kick in after that. Okay? So on the next slide, it gives a couple, I'm going to go over two quick examples of how the HSA qualified CareLink PPO Saver would work. So example number one, you suffer an injury to your shoulder. The doctor visit is to diagnose injury, and that visit is subject to the deductible. MRI, also subject to the deductible. It's then determined that you need to have surgery, which again would be subject to the deductible, and any follow-up physical therapy would be subject to the deductible. And if you are on a family plan, it is the full $3,000 deductible that you would be paying towards before your services are covered at either 100% or, you know, the applicable copayment. And the next slide is a second example of a routine annual exam and how that would be covered on the new plan. So your routine annual physical is covered in full. Any routine blood work, a flu shot, and any routine urinalysis would also be covered in full. If you are given prescriptions, those would be subject to the deductible. And when that deductible is met, prescriptions would have copayment attached to it. So then the next portion is you have a thyroid issue and you're at your physical, and they do an EKG and run some lab tests to check if your thyroid, check on that thyroid function. That is associated with a diagnosis that's not part of a routine physical. So those two tests would be subject to the deductible. You also receive a referral for a consult office visit with a dermatologist because your primary care physician did see a couple of suspicious moles. That office visit to the specialist would be subject to the deductible because that, again, is not part of a routine exam. Okay? And the next slide. Now that we are kind of talking a lot about deductibles, there's a way to reduce out-of-pocket expenses, and a great way to do that is by using freestanding centers. Freestanding centers can be utilized for things like colonoscopies, endoscopies, cataract surgery, and also high-tech imaging, MRIs, CAT CT scans, PET scans, any kind of nuclear radiology. Essentially, if you have these services in a hospital or a hospital-affiliated medical facility, more likely than not, they are going to cost more, and you would be responsible for paying more out of your pocket than if you receive these services in a non-hospital or freestanding center. And we tend to say around here, if Shield MRI is good enough for Tom Brady, then it's good enough for me, right? And that would be an example of a freestanding center that could be used for an MRI as opposed to going into Mass General to have an MRI done there. The same machine, just at a lesser cost. And the next slide, just a reminder that you as a member can access your information anytime, anywhere. Our portal is easy access to manage your plan. You can check any referral status, claim finder, view the mobile ID card, you can use the doctor search, and more. Talking about the freestanding versus hospital facility, charges for a MRI or some other service, you can check out the differences on EmpowerMe, which is our treatment cost estimator. It does allow members to compare and identify the best value for treatments and services in your plans. So you can utilize that tool while trying to manage your out-of-pocket costs. Okay. So with that, I am going to conclude my portion, and I'm going to turn it over to Health Equity to talk about the health savings. Thank you.
Thank you, Jennifer. This is Katrina from Health Equity. Let's go ahead and get started. So very first, I would like to introduce you all to Health Equity and what our role is and where we really come from. Health Equity is the oldest and largest health savings account custodian. And because of that, we are truly dedicated and we're passionate about health savings accounts and the way that they truly can empower our members to build their health savings, not just for now, but for their future as well. Now, with today's healthcare system, it's ever changing and it's complex and very confusing. And it's very hard to determine what you should save for future expenses and what you may encounter in the future. And because of that, it makes sense to ultimately prepare for those expenses like you prepare for your retirement savings. And an HSA is ultimately going to be the best way to do that. So let's go ahead and talk about why. So again, why choose the HSA? Because not only do you have the potential to save right now, you also have the potential to save for the future. Now, very first, I would like to point out that the HSA comes with a triple tax benefit. It's really a wonderful system. So not only are you saving tax benefits coming from your paycheck into your HSA, so again, tax-free monies going into the HSA account. You also have tax-free savings while the account is sitting there and accruing interest. So it's truly a savings account in that portion right there where the funds that are sitting in there are truly accruing interest. And the third of that triple tax benefit is that you have tax-free savings going out of the account as well. If you choose to use your funds on qualified medical expenses, which we'll touch on later in today's presentation, you will have tax-free savings there as well. So again, remember, tax-free going in, tax-free sitting there and accruing interest, as well as tax-free going out. I would also like to mention, with saving now, you have those lower monthly insurance premiums, and then you see your savings for the future. Your HSA funds are actually tied to your Social Security number, which means that the account is truly yours. It's an individually owned account, which means that your HSA funds will roll over year after year, and you will keep the money in the account even if you were to change jobs or insurance plans or retire. There's also some simple investment options that are built right into your Health Equity member portal, which again we'll touch on a little bit later. And the last thing I would like to mention is that you can keep your same doctors and your same network and your same negotiated discounts with the HSA plan. Next slide, please. Thank you. So with the HSA account, there are two big portions to it. You have the health plan, and then you have the savings account. So your health plan is that higher deductible HSA qualified plan through your insurance, through Tufts. You have your preventive services covered at 100%. And things like your office visits, your prescriptions, as mentioned, your deductible, those copays and coinsurance, that all will count towards your deductible and out-of-pocket maximum. Now, where health equity comes in, we will hold your HSA. We are that HSA account administrator, where you have those tax-free savings for your qualified medical expenses, and we really work hand in hand with your health plan. We will receive claims over, insurance claims over at Health Equity, so you can have a one-stop shop kind of way to manage your receipts and manage your claims and things such of that nature, manage your documentation. However, while we do work hand in hand, we work very closely together, it is important to note that we are two separate companies. Tufts will manage things like questions such as, what providers are in my network? Have I met my deductible? Things such of that nature. Health Equity will manage questions like, how much have I contributed for the year? What's this qualified medical expense? And my card declined, what's the problem? So while we do work hand in hand, we are separate companies. Next slide, please. So this slide is, I like to think it as a really great illustrative slide. It's really great for the illustrative purposes today. So what we're all used to is that traditional health plan versus that HSA qualified health plan. So what I'm going to do is I'm going to break this down into a $2 system. I'm going to oversimplify it. So you have your traditional health plan where you have $2 going directly into that monthly premium, and you have the lower deductible. Now both dollars are going into that monthly premium regardless of if you go to the doctor once or 100 times during the year. Now you have the HSA qualified health plan. You have a lower monthly premium and that higher deductible. Now because you have the lower monthly premium, only $1 out of your paycheck is going to go into that premium, leaving you with an extra $1. That extra $1, you can do whatever you would like with it, or you can fund that HSA. And because it is, again, tax-free, you're getting an extra stretch out of that $1 that's going into the HSA. Next slide, please. Now, how does the HSA work? So you will fund the health savings account with tax-free dollars. The HSA will then hold it, and then you can use those funds for qualified medical expenses. Now, qualified medical expenses have been set by the IRS into Publication 502. Publication 502 basically will break down into things such as exams, your prescriptions, procedures, even vision, dental expenses, and even more than that. Now, Health Equity has realized that reading an IRS publication isn't the lightest of reading, and sometimes the language can be kind of confusing. So we have broken down IRS Publication 502 into a website at healthequity.com/QME, which means qualified medical expenses. It will break down all of those expenses into things such as qualified expenses, potentially qualified expenses, and non-qualified expenses. A rule of thumb for all of those, so an example maybe, what you see here as qualified medical expenses, that's a great basis to keep of what your qualified expenses can be. So exams, your prescriptions, procedures, vision, dental. Things that potentially could be qualified expenses are things such as over-the-counter medicines. In order to purchase those with your HSA, you could want a doctor's letter of medical necessity or a prescription stating that you need that for your medical health. And then an example of a non-qualified expense would be a cosmetic procedure such as teeth whitening. So that's really great. It's a really great website where you have even a little search bar. So if you have something specific in mind, you can go to that website and search it, and it will tell you if that would be qualified, non-qualified, or potentially. Now here we have the maximum contributions for the HSA. Now the HSA, because it is a tax-free entity, the IRS has set restrictions as to what you can contribute into the account. Now for 2018, this is the tax year, the calendar tax year of 2018, you can contribute $3,450 if it is just you on that insurance plan. However, if it is you plus one or more people on your insurance plan, you can contribute $6,850. Now, if you're getting to that grand old age of 55, you can contribute an additional $1,000. Now, I would like to note here that because you are coming onto the plan, mid-calendar year, mid-tax year, it is important to note that you may not be able to contribute the full annual maximum if you do not plan on staying on this plan for the rest of the year. You may want to prorate your amounts that you're putting into the health savings account so you're not over contributing. However, if you are going to stay on this plan for the next full following year, you will be able to contribute that full annual maximum. So that is something important to know. If you don't feel like you may stay on this high deductible health plan, you may just want to prorate your annual maximum with these coming months. Now, how to add funds into the health savings account. The very first and best way is to make those pre-tax contributions through your payroll. And you can change your payroll deductions at any time. This is probably the most recommended way as you are going to be benefiting from the FICA and the Medicare and Social Security taxes on this. This is the most convenient way for you to get the biggest tax benefit out of that. However, you can still make post-tax contributions online or by check and claim it at the end of the year when filing your taxes to receive those income taxes back to you. So it's just filing it at the end of the year and you will still receive a tax benefit from contributing to your HSA account. You can also make contributions until the tax deadline for the previous tax year. Say you get to the end of 2018 and you notice that you haven't fully maxed out your HSA contribution and you want to get a little bit more of a stretch out of your HSA and out of your tax dollars. So you can, at that point, until the tax deadline, April 15th next year, you can make a post-tax contribution into your HSA and again claim that when filing your taxes. Now, we do recommend, if you are not fully funding the HSA account, at least fund the account before paying for a qualified medical expense. Now, if you're going to be spending these dollars for qualified medical expenses anyways, why not run that through your HSA and reap that tax benefit out of there? Now, this is a very, very important slide here, is the eligibility slides. Who can add funds to the HSA account? The cool thing about the HSA is a lot of people can add funds to an HSA account, but you as the account holder, this is for you as the account holder. In order to contribute to the HSA, that requires that you as the account holder can only be covered by the HSA's qualified health plan. That means any other health coverage may disqualify you. That includes Medicare, TRICARE, or another traditional health plan. You also cannot have access to a full purpose flexible spending account. So that's full medical purpose flexible spending account, and that includes through a spouse. So if your spouse is on a traditional health plan and they have the option to elect to have an FSA, and they choose to elect to have that FSA, you would not be able to contribute to a health savings account. Now, you also cannot be claimed as a dependent on anyone else's tax return. So those are the three biggest things. Next slide, thank you. Now, the HSA can really be used to help cover the Medicare gap. We see the HSA as not just a way to save for your medical expenses now, but also save for future medical expenses. You can really take this health savings account with you for your future medical expenses. Again, because it is tied to your Social Security number, these funds will never expire. Now, qualified medical expenses that would not be covered by Medicare can always be paid from your HSA, again, tax-free. Use your HSA to bridge that gap, fill those holes. Things that it can cover are things such as those prescriptions, your medical, again, dental and vision expenses as well, Even hearing expenses, that includes hearing aids as well as their batteries, are covered with the HSA. Copays and even Medicare premiums are eligible expenses to come out of your HSA. So again, the HSA is not just something that you can use for right now expenses, but for future expenses as well. Next slide, please. Now, Health Equity also offers an investment advisory services. So with the HSA, you have the option to start investing your HSA dollars. It's through a portal, the Health Equity member portal, and it's built right into your Health Equity member portal, this investment profile. Now, we realize that not everyone is going to be super savvy with their investments. I know personally I am not as savvy as I would like to be, which is where this advisor program comes in. Now, I'm going to compare this to a metaphor. This is going to be a really great metaphor that I love. So the advisor program is as if you were going to an unknown destination. You have to fly there, and after the plane, you need some ground transportation. The autopilot is as if you were to take an Uber or a Lyft or some sort of taxi. It is full service fund management based on your personal risk profile. So you tell us where you want to go with that personal risk profile, and we take you directly there. You get to sit in the back seat and watch which turns we're making, which funds that we are investing you in, and you do receive a weekly email letting you know how your funds are doing. This does come with an advisory fee of 0.08% charged to you monthly, which is about 80 cents per thousand invested, again, charged to you monthly. The next level of service is the GPS option. The GPS option is for those who are feeling a little more comfortable, and it's as if you were to go to the airport, you need ground transportation, you decide to grab a rental car and use a GPS navigational system. So that would be things such as like your Google Maps or your whatever map system you have on your phone. It is guidance provided for you, but it's implemented by you as the account holder. You are truly the driver in this situation. So again, you tell us your destination, that personal risk profile, and then you, the account holder, make those decisions. You get to turn the wheel and decide if you would like to invest in a certain fund or not. And then lastly, we have the health equity option, which is no advisory services added. Next slide, thank you. And then we have Health Equity's plan comparison tool. If you are debating on whether or not the HSA plan will work for you, let us do the math. I know every year at benefits time, I pull out that piece of paper and that pencil, and I try to do the math on if a certain plan will work for me or not versus another. Now, Health Equity will do that for you now. If you go to ConFORMis.com, you enter in the plan information, where you are with your taxes, things such as that nature, and we will lay it out side by side and let you know if the HSA qualified plan will be best for you or not. It will lay out your tax savings. It will also let you know what will benefit you best. It also has an email option where you can email it to potentially your spouse or to another family member or whoever you think. So it is a really great tool that will do the math for you, lay it out side by side in a non-biased way that will do the math for you. We also have another powerful tool. We have debit card access. So if you sign up with a high deductible health plan with that HSA plan, we will also send you a welcome packet that has the HSA debit card in it. It's really great on-the-go access right there to your funds. You also have a member portal, which I mentioned, that will be myhealthequity.com, as well as a mobile app where you can check your balance on the go, you can reach transactions, things such as that nature. It's really great for on-the-go access. Next slide, please. And lastly, our greatest and best tool that we have to offer here at Health Equity is our account mentor team. These guys are available 24/7, 365 days a year, and they are truly there to help you. I know that a lot of these account mentors personally, and they truly care about each and every one of the phone calls that they answer. They truly want to help our members the best way that they can. So please, if you have any questions, don't hesitate to contact our account mentor team. That does end my portion of the presentation. Thank you.
Perfect. Thank you, Katrina. One thing I'll quickly mention is if folks could please mute their lines so we don't get any background noise as we wrap up the presentation, that would be much appreciated. So lastly, we'll discuss the flexible spending accounts that are available to you. Similar to the way that the health savings account is designed, the flexible spending accounts allow you to set money aside on a pre-tax basis to allow. Sorry, we're getting a ton of feedback. Folks could please mute their phones. That would be very helpful. So as I was saying, the flexible spending accounts allow you to set aside pre-tax dollars to pay for qualified medical, dental, vision, or dependent care expenses. As Katrina mentioned, the advantages of setting aside pre-tax dollars is that you ultimately save on taxes, and the eventual goal is to help you reduce your out-of-pocket expenses. So you have access to 3 types of flexible spending accounts: the healthcare flexible spending account, the limited purpose flexible spending account, and the dependent care flexible spending account. And we'll go into greater details on all 3 of these accounts on the following slides. So the first one we'll discuss is the healthcare flexible spending account. This is not a new account. This was available to folks last year. An important thing to note is that if you will be enrolling in the high deductible plan and intend to contribute to the HSA, you cannot contribute to this account because that's called essentially double taxation, and it is not allowed by the IRS guidelines. However, if you aren't contributing to an HSA, you are able to set aside $2,650 per year, tax-free, to help pay for eligible expenses such as copays, deductibles, co-insurances, eyewear, dental services, ortho care, bandages, hearing aids, and much more. I would always recommend that folks look into what sort of qualified expenses are covered or are eligible to be covered under this. And last but not least, something that's new this year is that unlike in previous years, unused funds over 500 will be forfeited at the end of the year, but you do have the option to, or you have the ability to roll over $500 into the following plan year. Next slide, please. So the limited purpose flex spending account. This one is for folks who are contributing to an HSA. It works similar to the healthcare flexible spending account. However, it is intended to help pay for eligible out-of-pocket expenses for dental and vision procedures. This account is not used for medical expenses. That's where the health savings account comes into play. Just like the healthcare FSA, you can contribute up to $2,650 each year, tax-free. And again, this account is dedicated to folks who are enrolled in that CareLink PPO 1500 Saver Plan and contributing to their HSA. And similar to the way that the healthcare FSA is designed, you do have the ability to roll over $500 into the following year, but anything beyond that will be forfeited at the end of the year. Something important to note is that if you are switching plan designs next year and you have some dollars remaining in your healthcare FSA, you do have the ability to roll over this any remaining $500 up to $500 into this limited purpose FSA should you decide to switch plans next year. However, you will not be able to contribute to the health savings account until 60 days beyond the effective date. So essentially until July 1st, if you have any of that balance remaining. Next slide, please. And last but not least is the dependent care flex spending account, where folks can contribute up to $5,000 tax-free. The limit's actually $2,500 if you're married but file a separate tax return. So this account is intended to help you pay for dependent care for dependents under the age of 13 for the elderly or disabled. Some of the eligible expenses include adult or child daycare, summer day camps, which is a very popular one, before and after school programs, transportation, and of course a lot more. We always recommend that folks visit the irs.gov site to make sure that they're using these dollars for qualified expenses. So now we will open up the floor for any questions you may have. Again, this is your opportunity to ask questions. You will have more, but this is also a chance to really understand what's being offered this year. So if folks have any questions, go right ahead. So someone asked, not sure if you already mentioned, can you convert funds in FSA to HSA? The answer is no, you cannot. You can, however, convert the funds from the healthcare FSA into the limited purpose FSA, but only up to that $500 rollover limit. And then if you do that, you cannot contribute to an HSA until July 1st because of that 60-day run out period that's associated with the healthcare flexible spending account. Any other questions? Going once. Okay, great. Of course, in the meantime, if you have some time to digest this information, if you do have any follow-up questions, certainly don't hesitate to approach us when we come on site to do the benefit fairs. Oh, here we go. Here's another question. When can I sign up for flexible spending? I'm not sure I follow that question. So right now you have access to the healthcare flexible spending account.
You'll have the opportunity to sign up for a flexible spending during the open enrollment period. Other than that, it would only be if there was a qualifying event during the plan year.
Does that answer that question? Perfect.
And ConFORMis will provide you with all of the enrollment information at both the benefit fairs. Benefit resource will be on site to support, and then your HR department will also provide you with the paperwork and ways to enroll in the plan through ADP.
Okay, perfect. So if that does it, we will conclude our fourth webinar. Again, this has been recorded, and we will be sending out the recording in a little bit. Thanks, everybody.
Thank you.
Thank you.